Today I shall be talking regarding total hip replacement. So as you must be aware, hip joint is a ball and socket joint. So this is femur bone, this is head of the femur, and this is socket, acetabulum, called as acetabulum in technical term. So hip joint is made up of femoral head and acetabulum. So it is a ball and socket type of joint. As you can see in this model, this blue colored layer is called as cartilage. This is responsible for smooth or frictionless movement inside joint. When this cartilage starts wearing out, as you can see in this particular model, underlying bone starts getting exposed and it causes friction inside with each and every movement of the hip joint. So this is early osteoarthritis stage or early wear and tear stage. When this progresses, it leads to advanced osteoarthritis, as you can see in this model, and cartilage goes off completely and it leads to severe restriction in hip joint movement and very painful movements. So all day-to-day activities are also affected, walking becomes difficult, and so there are multiple reasons. Either it is osteoarthritis, primary osteoarthritis, or secondary osteoarthritis because of avascular necrosis, or in short form it is called as AVN. AVN, where blood supply of the femoral head is affected and it leads to wear and tear in the joint. Or it could be because of trauma, because of accident, some injury to the hip joint, or because of infection in the hip joint, or could be because of other types of arthritis like rheumatoid arthritis, so where it affects the joint and it leads to wear and tear in the cartilage. So in general it affects movements of the hip joint, it affects the smooth functioning of the hip joint is affected. So it leads to arthritis, as you can see in this model. So when we do THR or hip replacement, the worn out part of the cartilage is taken out and it is replaced with metal prosthesis. So the worn out portion is removed and the prosthesis is fitted inside the bone cavity like this, and on the socket portion it is replaced with the implant. So on the femoral side it could be metal prosthesis or a ceramic prosthesis. On the acetabulum side it could be either polyethylene or ceramic prosthesis. So either this could be ceramic on ceramic prosthesis or ceramic on the polyethylene, or various types of the implants for the hip joint. So when this is replaced with the prosthesis hip joint, movements become absolutely free, friction goes off, they become painless movements, and person is able to walk very next day after the procedure. Movements are allowed very next day after the procedure, and usually most of the patients, they are able to go on third or fourth day after the procedure. Physiotherapy is important after this procedure for first couple of weeks. Walking with the help of a walker for first 2 to 3 weeks. After that a stick is required for a week or 10 days, and after that person is able to walk without any support. For any further information, do not hesitate to contact SaiShree Hospital helpline number. Thank you very much.